Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth Warayudi. Sleep apnea's hidden link to stubborn high blood pressure, and trust me, it's juicier than your cousin's peach cobbler. If your blood pressure won't budge despite taking more pills than a handful of Skittles, the real culprit might be happening while you're catching Z's. Tonight, we're exposing the dangerous connection between sleep apnea and treatment-resistant hypertension. And folks, this connection is tighter than skinny jeans after Thanksgiving dinner. Let me paint you a picture of what I call the silent double threat. Sleep apnea affects 25 million Americans. That's more people than live in Texas, y'all. This sneaky condition causes your breathing to stop and start like a broken-down pickup truck throughout the night. Every single time your breathing stops, your body thinks it's dying and dumps stress hormones into your bloodstream like confetti at a New Year's party. Your blood pressure shoots up faster than a bottle rocket on the 4th of July. This creates what we doctors call a vicious cycle. Poor sleep directly drives cardiovascular disease, and most patients have absolutely no clue these two conditions are tag-teaming against their health like a pair of WWE wrestlers. Yep, entirely true, I can't make this stuff up. Now, here's where it gets really interesting, and by interesting, I mean downright frustrating for both patients and doctors. Why aren't your blood pressure medications working? Well, buckle up, Buttercup, because this is where the rubber meets the road. Treatment-resistant hypertension affects 30% of patients with undiagnosed sleep apnea. Think about that for a hot minute. Nearly 1 in 3 people struggling with stubborn high blood pressure might actually have a sleep problem. Every time your oxygen drops during the night, it causes inflammation that makes your blood vessels stiffer than week-old bread. Those stress hormones released during sleep disruptions, they're basically giving your daytime medications the middle finger, overriding everything you're trying to accomplish with pills. Without treating the sleep component, you're fighting an uphill battle against your own physiology. It's like trying to fill a bucket with a hole in the bottom. Let me tell you about a patient I recently treated. And if this sounds like you, maybe I should see you in the clinic because we need to talk. This 52-year-old executive came to me frustrated as all get out. He was taking 4 different blood pressure medications, following every instruction to the letter, eating right, exercising, doing everything by the book. But his numbers, still sitting pretty at 180/95, dangerously high territory that had him scared, and his wife even more worried. I sent him for a sleep study, and bless his heart, he had severe sleep apnea with 40 breathing interruptions every single hour. That means this poor man was basically suffocating 40 times an hour all night long, every night. His body was in constant fight-or-flight mode, pumping out stress hormones like a broken fire hydrant. After 3 months of CPAP therapy, that's the continuous positive airway pressure machine, his blood pressure dropped to 135/80 using the exact same medications, same pills, different result, because we finally addressed the root cause. This is the treatment game changer that gets me more excited than a kid in a candy store. CPAP therapy can reduce blood pressure by 10 to 15 points in treatment-resistant patients. That continuous airway pressure eliminates those oxygen drops and stress hormone surges that were sabotaging everything else we were trying to do. Study shows 70% of patients see significant blood pressure improvement within 90 days, and here's the kicker. Treating sleep apnea often allows us doctors to actually reduce blood pressure medications instead of constantly adding more. It's like fixing the leak in the roof instead of just putting more buckets on the floor. We're addressing the actual problem instead of just mopping up the mess it creates. So here's your actionable takeaway, and I want you to write this down or tell your spouse to remember it. If you snore loud enough to wake the neighbors and your blood pressure won't respond to treatment, march into your doctor's office and ask for a sleep study. Don't take no for an answer. This simple test could be the missing piece in your heart health puzzle, and trust me, your heart will thank you for it. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy. And remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.